Good evening. Thanks for joining us. We begin with a dramatic reversal when it comes to more money for our beleaguered healthcare system. A day that began full of optimism that the feds and provinces might have a new deal ended in disappointment. Tonight, with talks broken down, there is plenty of finger pointing. CTV's Ben Milger on the failure to find common ground.
Provincial and territorial ministers once again presented a united front after talks with Ottawa on increased federal health care funding went off the rails.
For the last year, the federal government has not responded to these requests for a meeting between the Prime Minister and premiers with respect to the Canada Health Transfer.
Federal Health Minister Jean-Yves Duclos says if the provinces want a meeting with the Prime Minister about more money, they need to go through him first.
Before we start talking about the means, we need to talk about the ends. And that can only happen and continue to happen at the health minister's table, and premiers need to let that happen.
Provinces and territories across the country are facing a staffing crunch, and the feds want them to come up with a pan-Canadian solution. But the provinces say they have varied needs requiring unique plans. While the politicians engage in finger-pointing, those working on the front lines in crowded hospitals point out that 1 million British Columbians don't have a family doctor.
The way that I look at it is care delayed is care denied.
Dr. Courtney Young, a cardiologist, says BC desperately needs more GPs, providing the kind of ongoing preventative care that can help patients avoid traumatic medical incidents like heart attacks and late-stage cancer diagnoses.
If we kind of take a few steps backwards and again focus on primary prevention where people aren't actually in the hospital, that will certainly help it.
Based on Tuesday's meeting, the feds and provinces are nowhere near a funding deal to make a dent in the staffing crisis.
After today, what do you say to patients and their families who are not getting the health care they expect?
With great respect, it's on behalf of those patients that we're making the case for a fundamental federal investment in public health care in our country.
And Ben Milger joins us now. Ben, you've been covering this for 2 days. I think we all thought there'd be announcements today. So what are the sticking points here that made it unable for them to reach a deal?
Well, mi-jung, this almost seems personal. The premiers put out a statement before the meeting was even over, calling out Justin Trudeau by name for failing to meet with them on health care. It seems like what the feds really want is a national plan, but the provinces say they are diverse and unique and one size won't fit all. At the end of the day, there's no deal, and it's the frontline workers and, more importantly, patients who continue to suffer. Mi-jung?
All right, thank you, Ben.